recording.
Hi, good afternoon, Natasha, and very welcome to our In Conversation with you this afternoon. Dementia SA is very, very pleased to have you on board with us this afternoon. Natasha, maybe you could just give us a little bit of an outline of what an epidemiologist actually does. What is epidemiology?
Yeah, so thank you so much, Karen, for having me, and I'm so excited to talk to you and everyone today. Epidemiology. So before about a year ago, no one really knew what epidemiology was, and everyone kind of thought it had something to do with the skin, which it most definitely doesn't. In short, I would say we are kind of the disease detectives. So basically, we look at data and the determinants of disease and try and suss out, what the causes are, what the patterns are of disease within the population, how diseases come about. And so basically, we are the data scientists of the medical world, if you could say it like that. A large part of what we do is also responding to outbreaks. So if there is a new prevalent disease within a community, we come in and look at potential causes and where it's come from, where it's starting, and using all that information to try and control diseases within the population.
Right, and of course there's some very, very well-known epidemiologists out there. So Dr. Fauci, Dr. Anthony Fauci, and a number of others that are really doing remarkable work, as are you at the City of Cape Town. So Natasha, what I really wanted to know, and these are questions that have really come out of our virtual support groups and some of our members via Facebook, etc. So really what we're wanting to know is now, with the rollout now in full swing in South Africa, where will people be able to get their vaccines? Where are those going to be available?
So I hope I can answer all your questions. It's a very evolving space at the moment and really rapidly changing. But where will people be able to get their vaccines? So vaccines will be distributed through both the private and the public sector. The national government is the one entity who is procuring vaccines. So every single vaccine, COVID vaccine that comes into the country will be bought by the national government, and then it will be distributed across the country. Depending on which province you are in, it depends where these vaccines will go. But both private sector providers and our public sector clinics and hospitals will have vaccine. So what that basically means is that if you have medical aid, you will get your vaccine through specific private sites, and that includes pharmacies. It will include some GPs. It will include some hospitals as well. I suspect that your medical aid will identify specific sites that you can go to. Within the public sector, we have also identified facilities from across the spectrum. So it includes government clinics, government hospitals, and as well as some purpose-built facilities just for vaccination administration. I think one of the most important things is that for every single person in South Africa, the vaccine will be free of charge at the point of vaccination. So your medical aid will not be charging you. It will not come from your medical aid savings. And similarly, if you access it through the public sector, you won't be charged for that visit.
Right. So, I mean, if somebody wants to be vaccinated, like for instance, now we have it's opened up now to the over 60, 65s. What about those then that want to have their loved ones vaccinated, but they're not as mobile to be able to get to a clinic also? Will there be mobile sites that one could register at, or is that not possible at this stage? Or because you say that it's evolving, is that a possibility?
Yeah, so it's something that's definitely on our radar. I work within the public sector, so I can't really speak for the private sector, unfortunately. But within the public sector, we are looking at mobile outreach teams, specifically to individuals that have limited access and limited movement. for those individuals within congregate settings, so those in care facilities or within older persons' homes, those facilities, we are planning to, either the staff at those facilities will be vaccinating the residents, or we'll send teams to those facilities to vaccinate the residents. So we don't expect a whole residential care facility to attend to go to a facility. Yeah.
Right. So would it be wise to say possibly that people that say live within a geographical area of a residential care facility to possibly go and put their name down, if it is within their area, because many of the carers are very, very worried about taking their loved ones with dementia who might become anxious and agitated and become a little bit unsettled to maybe a facility where there would be a long wait. And also to mitigate some of the risks of possibly contracting a COVID.
Yeah, so that's not a specific plan that we have in mind, but I think a very good idea and something I would take back to the planners. What is going to be available is that when you register, you have the choice of either being allocated to a facility, and so that would be a facility closest to your home, or you can choose a facility. And so what we hope is that when you choose a facility, that carers could choose a facility that they're comfortable with and that is known to them to receive the vaccination. But I'll definitely take that suggestion back to the planning team.
Great, thank you, because that has been one that's been raised by quite a few carers. The other thing that I wanted to know is that will the person be able to, or the family be able to say which vaccine they want? So would they be able to say they want the Pfizer, the Moderna, Johnson & Johnson, or is it whatever is available you get?
Yes, so currently it's whatever is available you get. We're expecting to receive the Johnson & Johnson and the Pfizer vaccine within South Africa. They both have their pros and cons, but overall they're both safe and effective. The allocation of which facilities get Johnson & Johnson and which get Pfizer will be dependent on a number of factors, including what we have access to at the time. Their idea was that our metros, our biggest city centers, would probably get priority access to Pfizer just because of the cold chain requirements, and they'll have a higher rate of vaccination in our more rural areas. But if we just receive Pfizer for a few months, we can't expect our rural areas not to vaccinate because of that reason. So really, it will be dependent on what's available as well as the distribution criteria.
Right. And, some people have expressed concern for some of the side effects because there has been negative publicity. How can they be reassured?
Yeah, so I think it's completely reasonable to be concerned about adverse events and the side effects. I think what really has been fantastic with the vaccine development as well as the rollout is really the rigorous testing that all of these products have undergone. So before they reached market, the clinical trials that they underwent really were thorough to test for vaccine-related events. But obviously, as you vaccinate more people, you may find some side effects which weren't found within the clinical trials, such as the most recent events following the Johnson & Johnson vaccine overseas, which were really very rare events. And I'm referring to the clotting disorders. But yeah, it's most of the severe events are few and far between. We've vaccinated internationally, gosh, it must be close to 200 million people. And there's been very limited severe adverse events. occurring due to the vaccines. And so I think that's probably the biggest reassurance, that there's so many millions of people across the world who've received these vaccines, and almost everyone is 100% well. Additionally, I think the rigor with which we are reporting potential adverse events and sharing that with everyone hopefully builds trust in the methodology that doctors and scientists and epidemiologists are using to ensure the safety of these vaccines.
Right. And I mean, surely somebody would know if they did have any kind of predisposition to any kind of blood clotting disorders anyway, and would, you know, move with caution. Is that correct? Or is
Yeah.
that
Yeah, so I would suggest, if you are at all concerned, if you've had a severe reaction to any sort of vaccine before, if you have a rare allergy to the contents of the vaccine, if you have had a previous clotting disorder in the past, to discuss with the person that's providing the vaccine before you take this vaccine, because every vaccine provider has been trained in recognizing what the warning signs, etc., are. And even before you get to that point, speak to a trusted doctor or whoever's your medical advisor before you go for the vaccine.
right? Right. And somebody asked whether it hurts.
So I received my vaccine yesterday. Very proudly and very excitedly. I can say that the vaccine, the actual giving of the vaccine, really wasn't painful at all. It was given to me by a very experienced nurse. So if you've had any sort of vaccine before, I can tell you it's more or less exactly the same as how that felt. I was just reassuring a colleague a few minutes ago that if 6-month-old children can receive vaccine,
Right.
I'm sure that us as adults can cope with a small needle stick as
Right.
well.
Right.
There's a little bit of residual tenderness in my arm, but other than that, I'm okay.
Right. Oh, well, that's wonderful. I'm pleased you've been vaccinated and that it all went well. That's great. And what are the timelines? I mean, I suppose we're talking about different timelines for different provinces, etc. But let's take, you know, Cape Town and see, you know, what are the timelines for rollout in Cape Town?
Sure. So this is all dependent on the vaccine actually being available. And so the timelines that I'm discussing now are what we are planning for. So currently we are in what's called phase 1, where all our healthcare workers are being vaccinated. And that should wrap up within the next 3 weeks or so, rather. And so that'll take us into mid-May. Mid-May, around the 17th of May, is when we expect phase 2 to start. And phase 2 includes individuals over the age of 60 and those persons living in congregate settings as well. Wow. We expect phase 2 to last until about September, October, where the phase 3 will start, and that's the rest of the adult population. And phase 3 should take us into first to second quarter of 2022, just depending on the vaccine availability. So those are the rough timelines that we're working towards.
Okay, and you're confident in terms of the stock levels of the vaccine, etc. You know, that's also quite an important thing, because I'm sure that the halting of the rollout or the Johnson & Johnson vaccine has also put, you know, timelines out.
Yeah, so actually, fortunately not, because it's 2 separate processes. The first process in phase 1 that we've been working through has been in a trial setting. So this stock has come from a different pool. So it's actually just given us a little bit more time to plan. From my colleagues in Provincial Health and National Department of Health, we are working towards the 17th of May. And the information that we have received is that the vaccine should be available. But obviously, you know, things do happen. and the whole world is fighting for vaccines. So it's just really dependent on when they get manufactured or when they actually land on that plane into South Africa. But there is a specific procurement and rollout plan. There's been a lot of discussion that the National Department of Health hasn't been planning well enough for the rollout, etc. But in my opinion, there really has been a lot of thought with regards to the purchasing and procurement and landing of the stock within South Africa.
Right, right. And I think just to wrap it up, I think people have been asking in terms of their loved ones, etc. Is it important with somebody who has maybe middle to advanced stages of a dementia to be vaccinated? Because there comes into play the whole ethical, they're not able to give consent, etc., etc. Just your personal thoughts on that. And I mean, I do understand it is a challenging one,
Mm-hmm. Yeah, well, I mean, I can give my professional and my personal opinion here. From a professional point of view, individuals with comorbidities are more at risk of severe COVID. And so that would include an individual with dementia. If one of the principles of medical ethics is first do no harm, and if that individual is needing assistance with most of their activities of daily living, and therefore unable to give consent, I would consider that a completely reasonable reason that they could receive the vaccine. And you've got to weigh up the risks and benefits. And I think the benefits of receiving the vaccine far, far, far outweigh any risk, and specifically with the risk of developing severe COVID if they didn't receive the vaccine. I mean, from a personal point of view, my father is an individual living with dementia, and I would completely support him receiving the vaccine as soon as possible.
Right. I think one of the other challenges that we do have, sorry, and my screen has gone Andy Warhol. There we go. So I think one of the things really is that because carers find it very difficult to get people living with dementia to wear a mask, etc., etc. Their challenges in terms of being exposed or at greater risk of being exposed certainly is that. So we do find the living with those comorbidities actually does make a lot of sense. That one does need to be vaccinated. So, and my last question is that I'm with Discovery Health. Does that mean that I go to the front of the queue? Or not necessarily?
Not necessarily, unfortunately not. I think Discovery Health has done a really fantastic job with informing their clients of the procedure. As far as I understand, they won't be receiving any preferential vaccine allocation. I think just as one of the largest medical aids within the country, they have the power to plan quite precisely with regards to their rollout. So they should receive vaccine at the same time that our public sector receives vaccine as well.
Right. Okay. Because with other comorbidities like type 2 diabetes, etc., I thought maybe it would shoot up there, right to the top, but clearly not. Clearly not. Natasha, it's been absolutely enlightening, and it's been wonderful being able to chat to you and to get some clarity on some of the things that our carers have been worried about. And I must apologize for my screen camera, but it's clearly not something that I think maybe a vaccine or two might be able to assist that. Yeah. But Natasha, thank you very, very, very much. We really do appreciate it. Just one very last thing. Would they be able to get it from their GP?
There will be select GPs that will be administering, but yeah, with the private sector, there's other planning that's happening. So definitely some, I'm not sure if all.
Okay, and where would we be able to get a list of those if you know, when it happens or if it does happen?
Yeah, I think they're still finalizing that list. From our planning side, these lists need to be in by the end of April. So the list should be available fairly shortly. So I would say before mid-May, individuals would know whether their GP was vaccinating or not.
Okay, and the same then would be for the residential care facilities who would be part of the program, etc.
Exactly, yeah.
Fantastic. Natasha, it's been an absolute pleasure having you here answering some of our pressing questions. And please be well, and I'm pleased that you've been vaccinated.